What causes recurrent UTIs, even with proper prevention? Recurrent urinary tract infections happen when infections keep coming back despite efforts to stop them. Many factors can contribute to this ongoing cycle. First, bacteria like Escherichia coli, which is the most common cause of UTIs, can sometimes hide in the urinary tract or recolonize from nearby areas like the intestines. Even after antibiotics, some bacteria may survive or become resistant, leading to reinfection. Anatomical differences also play a role. For example, people assigned female at birth have shorter urethras, making it easier for bacteria to reach the bladder. Structural issues like bladder diverticula, fistulas, or bladder prolapse can trap bacteria or prevent complete emptying of the bladder. When urine isn't fully emptied, bacteria have a perfect environment to multiply and cause repeated infections. Hormonal changes, especially during menopause, can thin and weaken the lining of the vagina and urethra. This reduces the natural protective bacteria called lactobacilli, making it easier for harmful bacteria to invade. Sexual activity is another factor. It can introduce bacteria into the urethra, increasing the risk of infection. Having frequent sex or new partners can also raise the chances of recurrent UTIs. Using certain contraceptives like spermicides or diaphragms can disturb the natural balance of bacteria in the vagina, reducing defenses against infection. Underlying health conditions such as diabetes can impair immune function and cause higher sugar levels in urine, which promotes bacterial growth. Chronic illnesses or immune disorders can also make it harder for the body to fight off infections. Genetics may influence susceptibility too. If close female relatives have frequent UTIs, there might be inherited factors affecting how bacteria stick to the urinary tract or how the immune system responds. Medical devices like urinary catheters or stones can harbor bacteria, leading to persistent infections. In the context of bladder health and bladder cancer, repeated infections and ongoing inflammation can irritate the bladder lining. While UTIs are not a direct cause of bladder cancer, chronic inflammation from recurrent infections should be managed carefully. If you experience recurrent UTIs despite prevention efforts, it is important to see a healthcare provider. They can perform tests like urine cultures or imaging to check for anatomical issues or incomplete bladder emptying. Treatment might include behavioral changes, topical estrogen for postmenopausal women, or low-dose antibiotics prescribed under medical supervision. Overall, recurrent UTIs are usually caused by a combination of persistent bacteria, anatomical or functional differences in the urinary tract, hormonal factors, lifestyle, and health conditions. Addressing these factors with professional guidance can help reduce their frequency and support overall bladder health. Remember, each person is unique, so personalized medical advice is always the best approach.